In this exercise, the patient will begin side lying with their top hip and shoulder forward. They will exhale, belly tuck by pulling their belly button to their spine to engage the core. Lift the knee 6 to 8 inches, and the muscle work should be felt in the gluteal area to teach them to activate this muscle. They will complete 2 sets of 15. In this exercise, working on glute medius strength, the patient will flex the knee and hip forward, nearly touching the table, then kick back up and diagonally while extending the knee. They will complete 2 sets of 15 reps for this exercise. For these abduction exercises, the patient will begin with a planted leg in a relaxed state at the hip, allowing it to gently fall out to the side. Then by pushing through the heel of the For the hip mobility warm-up progression, they will start by just moving from internal to external rotation. As they progress, they will move up into a lunge, activating the hip flexor, and finally they will move up into a side lunge, forcing them to activate the core as well. For the hip mobility warm-up progression, they will start by just moving from internal to external rotation. As they progress, they will move up into a lunge, activating the hip flexor, and finally they will move up into a side lunge, forcing them to activate the core as well. The patient is completing his trail leg movement over a height similar to the hurdle, slowly back and forth to help with neuromuscular control and learning the movement properly. For the core signals exercise, the clinician will palpate the internal or external oblique. The patient will then move through a rotation and perform a serratus punch, activating the muscle fibers. The patient will continue to do this, finding holes in the obliques and helping to activate the muscle. For core stability, the patient will perform a fire hydrant with a band around their knees, keeping the other side stable and not allowing the back to move. The wood chopper exercise allows the patient to practice neuromuscular control, gluteus medius stability, and perform the serape effect by doing cross-body motion, activating the obliques and rhomboid muscles. For this exercise, the patient will be undergoing ankle PNF patterns, moving from eversion to inversion with manual resistance. The resistance will increase as the patient becomes more proficient at doing the motion. This teaches the ankle to move in the correct pattern while performing technical movement. The patient will complete lateral plyometric bounds of the ankle, single leg. Cones can be put down to increase their height or decrease the distance in between the jump. This will teach the muscles to fire quickly and increase neuromuscular control as well as power. These jumps will be performed on an unstable surface, in this video a pillow, but it could also be used on a Bosu ball so that the joint is eccentrically loaded before they jump. They will go all 4 directions, forward, backwards, and side to side, allowing the joint to experience different positions, increasing power and stability. At the midst of his reevaluation, the patient had increased his hip mobility and increased his ankle range of motion as well. Still some shoulder drop due to core weakness, especially on the surgical side from his knee, but the glute med strength had increased as well.
And there could be a sweep here, ladies and gentlemen, the All-American in lane 4. On his left is Maurice Knight. On his right.
So with the wood choppers, I've now increased them so that he is single leg standing on a Bosu ball to increase neuromuscular control. He is also still doing the serape effect across his body to activate the obliques and the whole body. This exercise with lateral bounds is increasing power, endurance, and neuromuscular control when they land, and then they are doing their lead leg motion after they stabilize to continue functionality. To continue to increase ankle power and range of motion, we are still doing lateral bounds, but now up onto the Bosu ball, balancing for neuromuscular control, and then doing the trail leg motion to keep it functional. This exercise is a modification of the gluteus medius kickbacks, but now we have added in more of a power component because they're faster movements, and then also at the end we have implemented the ankle PNF patterns to do a combination exercise. This exercise is a modification of the functional hurdle trail leg exercise from earlier in the presentation. Now we have attached a resistance band and are working when the patient is fatigued to make sure that they keep good form with their hips and don't let the opposite side drop, causing glute med fatigue. After the 2 months of exercise, the patient has a decreased shoulder drop due to better oblique activation. We will continue to manage this throughout the next part of his rehabilitation. The patient now has a nearly neutral hip alignment while running in the same stage of their gait. This can be attributed to increased glute med strength and increased core strength. In the before picture, the foot is pointed backwards, but now that we have increased the dorsiflexion in the eversion, the toe is pointed forward, increasing power when going up into hip internal rotation and allowing for hip clearance without striking the knee against the hurdle. Through the hip mobility warm-up and through the passive mobilizations and all the other exercises that emphasize this movement, we have increased the internal and external rotation of the hip and maintained these measurements for over a month now. We will continue to do this maintenance-wise as necessary.